So before I move on and talk about the rib cage and the front portion of the axial skeleton, I wanted to talk about some abnormal curvatures of the spine. So there's three that we generally talk about. The first one is called kyphosis. It's a hunchback, and this is not just bad posture, although that can contribute. So bad posture is going to be an exaggerated curvature in the front of the top of the spine. So it's going to look like this, so like a hunchback. And so the person is going to have a hunchback, and they're still going to be looking up, but they're not able to stand straight up because their spine is actually curved, and it's not a muscular thing. Their bones have gone like this. And so it's usually caused by a lot of, like, not necessarily arthritis, but bone softening, and so it's just heavy. Now, some women during pregnancy, the weight of the stomach can pull that over, but it generally will resolve with some posture training post birth. Now, lordosis is a curvature in the low spine, and I actually tend to have this. Let me get up on my knees. And so this is an abnormal curvature in the low portion of the spine, and so it's like a sway back, and so it can make jeans very difficult to fit, find pants that fit. So, you know, you're supposed to have some curvature, but mine kind of is exaggerated like this. Like, you can actually put a whole hand here, and there's still a curve in my spine. Now, scoliosis starts with an S. That's because the spine looks like an S. So I can't really do it, but I'm going to try. So, like, it might be this way, it might be this way, and it's not necessarily the whole spine, but some of the vertebrae are not going to be stacked right on top of each other. They're going to be skewed in an S kind of shape. So none of those is particularly good. Scoliosis is usually surgically corrected. Kyphosis, there's not much they can do about. Sometimes seeing a chiropractor can be helpful to kind of help use muscles to position the spine in a better posture. But now, enough about the spine. Let's talk about the ribs. All right, so ribs here. My rib cage. This is not actually mine, obviously, but that would be a little weird. Okay, so this would be part of the rib cage. So this is the sternum area, and then this is the cartilage area for each of the ribs. Now, let's talk about the sternum. The sternum is actually several parts. So the first part is the manubrium, and that would be this portion. So it's round up here, and it goes down to this line. So this line generally corresponds to the second rib there. So this is a manubrium. After the manubrium, you move on into the body of the sternum, and this is where most of the ribs connect all the way down here. So this is the body. Body is fine. Also referred to as the gladiolus. I don't call it that. Body of the sternum, totally fine. Now notice that a lot of these bones have a body, so make sure when you're identifying them, say which bone it is. So don't look at this and go, that's the body. Body of the sternum, sternal body. That would be appropriate, because I don't know, you're talking about the body of the sternum and not the body of the vertebra. Be specific. Now, after that, you have the xiphoid process. In this particular model, it's not sharp, but it actually is very, very sharp, kind of like the point of the sacrum, the tailbone there, so very sharp. You can probably feel yours, so sit up real tall and kind of push, not on your belly button, but find right where your ribs are, and you can push down. You can usually feel it. It doesn't really feel good when you push it, but anyway. All right, so there's the three parts of sternum: manubrium, body, xiphoid process, and that's an X, xiphoid. Next, you have the clavicular notch, and that's going to be up at the top, right in here, and this is where the collarbone is going to connect. Notice the collarbone is going to connect above the ribs, so the clavicle, that's the collarbone, clavicle. So the clavicular notch, so there's one on each side. So to form, think about your collarbone, so it forms there. So then you have your jugular notch, and so it's not very pronounced on here, but you can feel it on yourself. Push it. This is right here. This is your jugular notch. So here's where your collarbone's connecting, and then the top part of your manubrium right there, you can feel it. That's your jugular notch. So here's clavicular notches, jugular notch. Now your sternal angle, that would be this line here where the manubrium and the body of the sternum come together. I don't really know why it's called an angle, because it's a line, but somebody decided to call it an angle, so it's an angle. Now, these are all your costal or costal referring to rib cartilages that connect the ribs. Now you have 12 pairs of ribs. Notice 1, 2, 3, 4, 5, 6. Then they kind of go on down. 7, 8, 9, 10, 11. But now you have your true ribs. There's 7 of them. 1, 2, 3, 4, 5, 6, 7. These connect directly to the sternum. 8, 9, and 10, these connect indirectly. These are called false ribs. So true ribs, there's 7 pairs, 1 on each side, and they connect directly to the sternum with this cartilage, and they connect to the vertebrae, so all around. These actually form the cage. Now, 8, 9, and 10, they're false ribs because they don't connect directly. They're kind of branches out of this 7th one. And then ribs 11 and 12 actually only connect to the spine, and then they come around. So I wish I had a full-on skeleton to be able to show you that. But if you look on page 271, there's a pretty good description there. So let's turn the page, and I have a rib. This is a rib. This is not one of my ribs. It's very large. Okay. So when you have a rib, and this is one that's going to be connecting to, I need a thoracic. Where's my thoracic one? Here we go. And again, this is not the one that's meant to connect to this. Maybe it is, but okay. So when you have your rib, the rib is going to connect to the vertebrae here on this real sharp angle here. So this is the part of the rib that's going to be connecting into the vertebrae. And I'll figure out that in a little bit. So the head of the rib is this portion right there. So this end, so you find this sharp angle of the rib. The rest of this is going to be curving around. So here, this is the head of the rib. The neck of the rib is this portion. So here's the head, here's the neck. And then the tubercle, which would be this part, this little notch here, that's what's going to stick onto the vertebrae, and the rest of this is just called the shaft. So where it sticks onto the vertebrae is right there. Look at that. Isn't that so beautiful how it just connects on there? Yeah, right there. There at the back. So this is a floating rib, and then it curves all the way around. That didn't work out very well. So here it's connected on this side. Now I got it all mixed up. Connected again. There we go. Maybe. Alright. So here's the front. Just connects all the way around. Very nice. Okay, now, don't get the rib, I'm shaking the rib, confused with this. This is the clavicle. This is not a rib. This is part of the collarbone. Now, so this is a clavicle. And the only thing we care about on the clavicle are two ends. You have this rounded end here. This rounded end here. This is the acromial end. And this is what's going to connect with the scapula, the shoulder blade. We're going to talk about that in a little bit. And then you have this end, and this is the end that connects with the sternum. So here's your sternum. And so this is going to connect in here with the sternum right there. Seeing that nice little notch? So this is the left one. So and then it's going to form that nice little collar, go around the neck, and move my hair here. It is supposed to stick out like this because that's going to connect to the top part of your scapula. So feel, you're just going to feel your sternum, feel that jugular notch there. Okay, so this is your clavicle. So here it is. Here it is, right here. Look like that. And it just kind of goes right there, sits on top of your shoulder, and that's going to connect to the scapula. So this is the clavicle, collarbone, clavicle. Connects to the sternum right there on your clavicular end. Oh yeah, so nice, right there. Now, and then this part is going to connect, the acromial end is going to connect with the scapula, which is what we're going to talk about.